My name is Joan Hardman, and I wrote a letter to the Chief Executive of the Trust in order to thank the Rapid Response Team, who I was very impressed with the overall service, because I had to use them very urgently in July. I'd never heard of the Rapid Response Team before, but I was delighted to have their services because they really were a godsend this particular evening. And it was through the GP, and he contacted the team, and a nurse came out and helped me to get my husband to bed, and came next morning with another nurse. And at that time my husband really was very poorly, and the GP was called again by the senior nurse from the Rapid Response Team, and he was admitted to hospital. We didn't have to go through A&E, we went straight to the assessment unit because the GP had already been onto them when he ordered the ambulance. And then on discharge the nurses came again, and then the physios came, and they came every day for a week, the physio technicians, and then followed it up afterwards. We've since used them again in October when my husband had a chest infection. And the nurses didn't come out, but through the rapid response we got carers in sort of for a couple of days for sort of emergency action, really getting him up and pushing him to bed. I felt that they were very professional when they came. They were certainly efficient and knew what they were doing, and also they were very nice in their approach. They were both very kind to me and considerate, and the same as well with my husband, and very patient when they came in, and the physios, the technicians and that, and also left me with a list of exercises that he needed to do throughout the day. And also we have a community physio that works out of Whitegate Drive, so if needs be we can contact her as well if myself or my husband want to come in and advise on anything. So that also was a referral from the Rapid Response Team. I felt that in view of all the service that we'd had, it was important that I wrote and complimented the staff, and obviously it's a very important community resource. And also I wanted the senior staff in the Trust to know what a valiant and valuable service that these staff members of the Rapid Response Team carry out.
We are really grateful for the feedback from Mrs. Hardman. Due to the crisis nature of our caseload, we rarely get to know how our patients are getting on after we discharge them, and it is wonderful to know Mrs. Hardman is doing well. It is fantastic to hear that we are able to reduce Mr. and Mrs. Hardman's anxiety by providing efficient professional care at home, and that our good relationship with other community services has enabled seamless ongoing care for Mr. Hardman. We would also like to thank Mrs. Hardman for the time and effort she has taken to show her appreciation.